Well, welcome everyone to our webinar, Driving Change, Health Equity and Environmental Justice in Transportation. Before we begin, all of us at the Medical Society Consortium on Climate and Health respectfully acknowledge that our advocacy, education, and learning across the country takes place on the occupied and unceded lands of many Native American tribes. To acknowledge this land is to recognize its long history and our place in that history. It is to recognize these lands and waters and their significance for the peoples who lived and continue to live in this country, and whose practices and spiritualities were, are, and shall always be tied to the land and the water. Today's webinar is the 6th in our 2024 Climate and Health Equity webinar series as part of the Climate and Health Equity Fellowship Program. The T.H.E program recognizes the need for more diversity in climate and health leadership and a sharper focus on equitable climate solutions. The goal of the fellowship is to empower doctors of color from populations that face greater burdens from climate effects and are underrepresented in medicine to become leaders in climate and health equity education, advocacy, and policy solutions. I'm Dr. Shanita Johnson, Director of the Climate and Health Equity Fellowship. Also joining me from the consortium to run this webinar are Dr. Venice Curry, Associate Director of the Climate Health Equity Fellowship, Dr. Kimberly Williams, Director of Operations and Strategy at the Medical Society Consortium, and Clarissa Payton, T.H.E Program Assistant. Clarissa will be available through the chat to answer any technical questions during the webinar. The webinar series is hosted by the Medical Society Consortium on Climate and Health, and is held for 1 hour on the second Friday of each month from 3 to 4 p.m. Eastern Time. Today's webinar will be recorded and made available on our YouTube channel and website for future viewing. This year, we are excited to continue our initiative of offering CME credit for our webinars. Instructions on obtaining credit will be provided at the end of the webinar. The transportation sector is one of the largest contributors to U.S. greenhouse gas emissions and has a significant impact on our climate and our health. It is imperative to discuss transportation and the implications of its impact on climate, health, and equity. Today, we are honored to have Dr. Sacoby Wilson, professor at the Maryland Institute for Applied Environmental Health, University of Maryland, College Park, and director of the T.H.E. EJ Lab at the University of Maryland, College Park. Dr. Wilson is an internationally recognized leader in the environmental justice and health equity movement, who has led and continues to lead numerous efforts to achieve equity in health policy issues, especially those impacting vulnerable, underserved, and marginalized populations. His areas of expertise and efforts include exposure science, environmental health disparities, community-based participatory research, and providing technical assistance to communities fighting against environmental injustice and environmental health disparities in the DMV region and across the nation. But rather than using our time to provide a further description of his impressive work, we are placing a link to his bio in the chat. The general format for today's webinar will be one 40-minute presentation by our speaker, followed by 10 to 15 minutes of question and answers from our audience. We ask that you put comments, links to any resources that you may recommend, or any questions that you may have for the presenter in the chat box at any time during this presentation. We will get to as many of the questions as we can during the Q&A period. Please remember to keep yourself muted so we are not interrupted by background noise. Dr. Wilson, please begin.
Thank you. Thank you. Yes, it's always great to keep that bio short because it's way too long. You had me laughing. I'm really excited to be here today. So what I'm gonna do is present about transportation issues and energy justice issues, because those two things are connected, and integrate connections between transportation, energy, and also climate change. So, but really be grounded in a justice frame. So let me make sure. Hold on a second, y'all. Uh-oh, the laptop is already. Okay. So can y'all still see me?
Yes, we see you and we see the title slide.
Okay. I may have to. Seems the laptop is not liking me. Okay, there it is. Okay. Sorry, y'all. So do a few definitions, talk about, again, some of our justice perspective, transportation issues, and I'll get into some of the energy justice issues around fossil fuels later in the presentation. So we know what environmental justice is. So I'll skip this because I think it's important, though, to remember how we're grounded in environmental justice when it comes to transportation. So really today, I'll be talking about, again, transportation and energy justice and how the role of transportation is really connected to, history in our country. Think about segregation, disinvestment, divestment, the destruction of communities, but also, again, when you think about all the combustion byproducts, greenhouse gas emissions and co-pollutants that have a negative impact on public health and can drive, health inequities. And, when you think about transportation in our country, there's a history of, inequities in transportation policies, and a lot of it's baked because of racism. And so I just wanted to note that when we look at whose communities have highways and byways, whose communities have more multimodal, types of transportation, where you have biking lanes or you have, more buses, right? And then whose communities have access to more electrified buses? Race and racism may play a role in that. And so if you look at the history of transportation in this country, you had to connect it to other infrastructures, right? So you had to talk about housing policy. For those of you know the history of the US, there was this whole sort of America Beautiful movement where folks moved out into suburbia. It was this American dream framing. But many folks didn't have access to that suburban, that new home and that, yard with the white picket fence. But a lot of our federal policies, post World War II, really drove the suburbanization in our country. So when you have more suburbs, you have to build what? You have to build highways. And so you have this American Beautiful movement. You also have the American part of the American dream is having your car. So those two things are connected: access to suburbia, and highway use, and sort of our love affair with cars. But looking at the history of segregation, housing segregation in this country, you can connect that to some of the actions about it, now through the National Housing Act and the actions of the Federal Housing Administration. And just want to, again, kind of ground us in history to understand why some communities will have more highways and byways, and bisected and dissected by highways and byways. And what does that mean for community health, sustainability, and quality of life when you have so many highways that were built on purpose to these communities? So housing wasn't really a responsibility of the government prior to the 1930s. But again, all the policies, Great Depression, post-World War II, led to many Americans seeking access to, homes. And think about, again, y'all, the role of home ownership when you think about the wealth gap, right? The role of home ownership when you think about, air property, ability, intergenerational justice, being able to pass that down to the next generation, and how you build wealth, and how some groups were able to access these loans and some weren't, right? And so you had this kind of idealism with suburbia, back in, Great Depression, going to, World War II. But again, some Americans were able to access that suburban dream and some weren't. And so what we have with, the issues around redlining, again, redlining is neighborhoods where, because of the constituency, the demographics of the population who lived in that neighborhood, they were, deemed to be hazardous. So, color red is hazardous. So if they had more people color, other individuals that were deemed to be less desirable, then that neighborhood was colored red, hazardous, and they were not able to get access to housing loans, right? And then you also see the issue around, so the government lending and differential lending, right, based on race, based on class, led to what we have redline neighborhoods, okay? And also with doing this suburbanization, and also a lot of the work that was happening in the civil rights movement, you saw a pushback against sort of the progress in the civil rights movement, and you saw white flight because of the opportunities that suburbia provided to whites to get away from people who were deemed less desirable. You see that connection between suburbanization, the FHA policies, segregation, and also redlining and white flight. And so you have urban sprawl in the post-war years. So a lot of suburban communities were developed. And again, to get from the urban core to a city, to suburban sort of outskirts of the city, right? You have to have highways and byways, okay? So that's the connection. So you think about the National Highway Defense Act, and I'll get to that slide. That was another government policy where some people were differently impacted by it and some people differently benefited from it. But again, because of our investments in suburbia, because of the FHA's differential application of policies and loans, you see a lot of sprawl happening with urban cores getting these suburban rings, or what we call ex-urban rings, okay? So the Interstate Highway Act in 1956 provided a 41,000-mile highway system to better connect our urban cores to our suburban rings, right? But again, and it was biased transportation, biased in front of high speed, limited highways. But again, and it facilitated the establishment of suburbia and also the establishment of infrastructures to support suburbia. But at the time, suburbia and those infrastructures, when everybody did not have access to them. So highway building was an EJ issue. So think about during the Jim Crow era, you have racial residential segregation, but along with the suburbanization, urban sprawl, you see a lot, as I said before, refusal of loans based on race. Between 1945 and 1959, Black Americans received less than 2% of federally insured loans for their homes, right? While white Americans were able to move back and forth from cities to suburbs, right? And you saw an increase in automobile sales for white Americans. So again, thinking about the engine, combustion, how we combust fossil fuels. So again, you see the expansion of highways, increase in automobile sales, right? This love affair with suburbia, this love affair with, the car, this love affair with, getting your car and driving on a highway. And what does that mean when you're combusting fossil fuels, right? When you're combusting gasoline, what does it mean for air quality? What does it mean for climate change, right? What does it mean for public health? So again, because of the differential access to loans, because of redlining, you also saw, gentrification occurring as well in some of these urban locations. So some people were displaced when these highways were built. So you may have seen Secretary Buttigieg over the last couple of years talking about, making communities whole because of Department of Transportation was the main sort of driver during the time of the Highway Defense Act, building all these 41,000 miles of highways. They were the main driver of that, but those highways were placed primarily in Black and brown communities. So again, when you have highways going through your communities, think about it, y'all. If you're driving into DC, for example, Washington, DC, for example, or wherever city you're in, you may be in LA, you could be in Charlotte, you could be in New York. When you drive through a community that's hosting that highway, that byway, when you combust fossil fuels, you're using that community as a sink for pollution. So you have greenhouse gases that are being released, right? And we know their role, carbon dioxide and methane, as climate forcing gases, right? They contribute to, urban heat islands, also extreme temperatures. We see what happened right now with the hurricane season. We're seeing major, Hurricane Debbie, for example. So think about climate change and more intense hurricanes, more rain associated with those hurricanes. You go back to Hurricane Harvey, for example, Hurricane Michael, Hurricane Sandy, of course. Next year is going to be the 20th anniversary of Hurricane Katrina, August 29, 2005. But also you have other impacts when you think about greenhouse gases. But then the co-pollutants, for those of you that's called as medical professionals, those co-pollutants that have a direct impact on cardiopulmonary functioning, right? Respiratory systems. So think about the role that particulate matter, volatile organic compounds, nitrogen dioxide, PM10, PM2.5, PM1. So particulate matter, 10 microns in diameter, 2.5, 2.5 microns in diameter, PM1, the ultrafine particles, right? Their role in driving poor respiratory health outcomes, particularly for folks who live in communities with what? A lot of highways, a lot of traffic, what we call traffic-related air pollution, okay? So at one point, you have folks who have been displaced by the building highways, and at the same time, once the highway is in operation, if they've been displaced, the people who have been left behind are being dumped on. They've been exposed to the pollutants. So think about that, y'all. So as we continue to, expand our highways, so we do the highway maintenance. I'm not sure where everybody is, but you're driving up and down the highway. Like in North Carolina, for example, there are multiple highways where there's constant construction work. In Baltimore, constant construction work. In DC, that's a good thing in a one way, right? You want to maintain that. But then if you have cars on the road that are combusting fossil fuels, that is not a good thing. It is not a good thing for the residents, particularly those that are vulnerable or susceptible, right? Who live in close proximity to those roadways, particularly if there's no buffers, whether it be physical barriers, concrete buffers, or natural buffers, like trees, for example, that can help with air pollution mitigation. So Dr. Bullard talks about these issues in his book, Highway Robbery, Transportation Racism and New Routes to Equity. So freeways physically isolate residents from their institutions and businesses. They displace thriving businesses. They contribute to urban sprawl. Then you end up having infrastructure decline. I mean, those of you, again, who go into different parts of big cities where you see some highways are falling apart, and then the business infrastructure, they become ghost towns, right? So a highway can end up killing a healthy community. And of course, as I've already said, when we burn fossil fuels, we leave combustion byproducts behind. Minnie Fuller talks about root shock. So again, how all these highways been built through neighborhoods, and this stress reaction that occurs to the destruction of one's community, and the ripple effects across multiple decades. So that's a intergenerational injustice. So a highway was built 50 years ago. Think about the impact that it can have in the community today. So I've done some work in North Charleston, South Carolina, working with Low Country Alliance for Model Communities, LAMC. And, they had this issue where in 1956, they were displaced. Folks were removed, right? And now recently, they're expanding I-26 and I-526. For those of you who like drive to Charleston, right? When you're driving to Charleston and all that, the yellow brick road of, Charleston, one of the, showed as one of the best cities in the country, right? You're going to hit through North Charleston. There's a lot of pollution and a lot of displacement that's happened. And so now they've been hit again by it. So they were hit by highway, development and displacement in 1956, and it's happening again in the 2020s. So look at this picture, North Charleston, South Carolina, before highway project and demolition. So when you build a highway and expand it, you're going to demolish folks who are already being left behind previously, right? So so we think about these issues around climate change and equity, you have to talk about the issues of transportation equity and the inequities that occur when we build highways. So it's not just the impact on air quality, it's not just the release of climate forcing gases like methane and carbon dioxide. It's also these other ecological and social and economic impacts that communities experience. Think about Tulsa, Oklahoma. Y'all, we know the history of Tulsa. We know the Black Wall Street and the race massacre. But then look at a picture of Tulsa, 1967, and look at it. I'm gonna go back, y'all. 1967, and look at it with these new highways that get built, and how you have folks get displaced, but then you have a road expansion. The road goes from a 2-lane road to a 4-lane highway, or it goes from a 4-lane highway to a 6-lane highway, or it goes to a 6-lane highway from an 8-lane highway, or it goes from an 8-lane highway to a 10-lane highway. For those who drive, 85 in Atlanta, y'all know the Atlanta Speedway. You know what I'm talking about. So all the roads that are going through people's communities, right? And think about all the combustion that happens. So again, because of climate change in an urban area, those climate forcing gases get trapped, increase the urban heat island, right? So folks are been exposed to physical stressors like the chemical pollutants, their combustion byproducts, right? But at the same time, not been exposed to a physical stressor, heat, So what does it mean for you when you're working in communities, right? Whether you have an active population that you're serving as a medical provider, and they've been exposed to both heat and pollution, and they're trapped in an area with a lot of combustion byproducts because of the freeway. Alamance County, North Carolina. I did some work in West End as a grad student. West End is a neighborhood in near in Mebane, North Carolina. So Mebane is west of Chapel Hill. I went to UNC Chapel Hill for grad school. And so you have these issues that sort of, remember I said earlier, inequities in planning, zoning, development. You have issues with zoning and planning that drive these differential impacts. So what was happening in Mebane was they were going to build a highway to connect to Danville, Virginia, that would displace these post-slavery Black neighborhoods that were primarily elderly and primarily low income. Okay, they were going to pave over Black churches and Black cemeteries. So you think about transportation and justice, we don't care about your living and we don't care about your dead. Okay, and so they were able to submit a complaint to the Department of Justice to say that this highway project was an example of environmental racism. So when you think about, again, in this program y'all are in, if you're going to address the issues of climate change, inequities in preparedness, response, recovery, inequities in mitigation, adaptation, resilience, and think about who are the groups that are most vulnerable, most susceptible. Remember what vulnerability and susceptibility. Of course, y'all know this. They're different sides of the same coin. Vulnerability is extrinsic, right? Susceptibility intrinsic. So I know we use them interchangeably, right? But think about someone, your most vulnerable and most susceptible population in the context of dealing with climate change, and they live in a place where they have a lot of highways, a lot of concrete, a lot of asphalt, no trees, and lack of access, particularly to medical care. How are we protecting those populations? What can we do about that? Of course, we'll get to that in the questions. I know y'all gonna ask me that same question. I'm gonna pose the question to you first. So let me keep going. So then you think about this highway project. So basically, this 119 bypass was being built, and so the bypass was going to really displace these neighborhoods that were primarily Black. And one of the things I want to talk about that you may not have heard this term before, and I used the phrasing inequities in planning, zoning, development. In many towns, you have your town, you have your town, you have your municipal zone. I can't talk, y'all. Municipal zone. I'm sorry, y'all, I'm laughing. You may have this extra area outside the town limits called the extraterritorial jurisdiction. So it's like people who live in the ETJ live in a no man's land. They have no control over planning, zoning, and development. So again, what are the ways that the root causes of transmission inequity, right? You see the role of race and racism is baked in some of this. So if you live in the ETJ, they can do whatever they want to do. So that's part of the reason why these communities were targeted, because they were in the outside extraterritorial jurisdiction of Mebane. And why is that? You may ask the question. Well, when Mebane was developing, and remember I used to talk about Jim Crow before, they did like an amoeba. The Black parts of town were excluded from being part in the town limits. So they were stuck in ETJ and stuck in no man's land when it came to having proper voice and power in decision-making about planning, zoning, and development. And you see that a lot, y'all, with transportation projects, that those are most impacted don't have power and voice and decision-making about the projects. So Washington, D.C. is another example where we're trying to do highway expansion and be able to, better connect folks who live in the suburbs to the jobs in the city. But again, when you have those highway projects, right, those highways are going through people's neighborhoods. So again, when we combust fossil fuels, whether it be from our passenger vehicles, whether it be through small trucks, whether it be through our, buses, right, or larger industrial vehicles like, big trucks that maybe, doing construction, or trucks that may be associated with goods movement. Think about from, moving goods from ports, et cetera. We are going to be releasing fossil fuels. So look at Baltimore in 1959. There's a project called Highway to Nowhere. The initial project was the 22-mile route. Just 1.4 miles were constructed. And so during urban renewal in Baltimore, greater than 25,000 people, that's not 20, so I messed it up, 85% were African Americans were displaced from their homes. So again, this just shows what highways do. It's not just the pollution impacts, right, from the operation of cars on the highway, it's the building of the highways, it's the construction of the highways themselves. So, and now look in 2010. So I'm gonna go back to the previous photo, look at the road system in 1959, and look at all the highways and expanded road networks in 2010. So people got displaced, and the folks that are left nearby are being exposed to higher concentrations of combustion byproducts. Houston, Texas is another example of this. And I just want to just give y'all examples from across the country. Many of you have probably driven through Houston. Just a point of reference about Houston. Houston, I think is the third largest, the fourth largest city in their country. It does not have comprehensive zoning and planning. So it's the wild, wild west of zoning plan development. So that's why you see all these crazy types of highway configurations in Houston, because they don't have any real planning. And then so whose communities are being impacted disproportionately. And so again, it's not just the issues around heat and air pollution, but because of, you remember Hurricane Harvey, and think about now with climate change, when you think about the issues of extreme precipitation or even light precipitation, we have so many road networks with a lot of impervious surfaces. Where does the water go, y'all, when it rains? There's no sponges. There are no wetlands. There's no natural spaces for the water to be absorbed to. So you have that water sits, that water runs off, right? And then, the power of water. You see a lot of people, when you think about injuries and when flood events, because they may be living in an area that has too many impervious surfaces, right? And maybe the pavement is not a permeable pavement. And this leads to other impacts outside of just, again, the heat and the air pollution impacts when you think about highways. So I'm gonna keep going because I know I'm getting low on time. I got some more slides to get to. Me speed up a little bit. So just as another example of when you look at highway expansion, and you have a lot of public housings. Remember, that's a connection between housing and transportation. So who's impacted by these highway projects? What vulnerable populations will be displaced? Or what vulnerable populations will be left behind to, breathe in those combustion byproducts that can have deleterious effects, not just, when it comes to, lungs and, heart, etc., but also can lead to reproductive effects, can lead to mutagenic effects, can affect telomere lengths for those who do the work know about telomeres, can also have other adverse, non-cancer related health effects, right? So 1953, this is Houston, Houston's 4th Ward, okay? Largest settlement for freed slaves in the 1860s. It was impacted by urban renewal housing, and now look at the area. So again, highways, see the larger, taller buildings that have been built. So a lot of people have been displaced. So let's make a connection between the transportation justice issues to energy justice. So just real quickly, a lot of families are dealing with energy poverty. So low-income families have about a 3 times greater energy burden compared to higher income households. So those households are going to be more at risk of an energy disconnect. They may have to choose between paying an energy bill and paying for food, and then dealing with energy insecurity. So if you think about and I want to make sure I say this so I may forget it later. You think about right now with the Biden-Harris administration and the Justice 40 framework, and of course about the Inflation Reduction Act and the bipartisan infrastructure law. There's billions of dollars that are available to help us with a clean energy transition. Part of that clean energy transition will be helping folks who are dealing with energy poverty, who are dealing with energy injustice, okay? Particularly when it comes to their monthly income and have to pay so much of their money to their energy bill. And that's more of an indoor issue, right? Think about weatherization, healthy homes, et cetera. But also this energy poverty could be applied to, outdoor environments and experiences when it comes to transportation. So energy justice incorporates 4 basic rights: a right to healthy, sustainable energy production, a right to the best available energy infrastructure. So whether it be access to microgrids, whether it be access to, advanced heat pumps, right? Advanced HVAC systems in your home, moving away from gas stoves to electric stoves. I know many of us love our gas stoves because that food tastes good. But when you cook with a gas stove, you're creating combustion byproducts, and also gas, natural gas, euphemistically, also releases greenhouse gases, right? But then also, when you think about best available energy infrastructure, having access to electrified vehicles potentially. We know that many, lower income individuals still with the tax credits, tax rebates cannot access EVs, cannot access hybrids. And so that's still an equity and transportation justice issue. And also the right to affordable energy. So the right to clean affordable energy, and a right to uninterrupted energy service. So again, I said a lot of folks who are maybe on LIHEAP, they get an energy assistance programs, right? Because they're low income, they may be at risk of having their their power turned off. So this is the energy justice framework. But for purposes of our conversation, when we think about when we talk about transportation, the right to healthy, sustainable energy production, and the right to the best available energy infrastructure. So we know I've talked a lot about fossil fuels, and we know that fossil fuels have a major impact on air quality when we combust them. Of course, our love of fossil fuels, our addiction to fossil fuels, are a huge driver of climate change, right? So if you think about fossil fuel infrastructure, you can go from extraction of fossil fuels, right, and the negative impacts on human health and the environment. You can go to transport through our pipelines of fossil fuels and the impact, refining fossil fuels and the impact, or producing like plastics from fossil fuels. And of course, this part of this discussion we're having today, combustion of fossil fuels. Of course, combustion, when you think about energy production, coal-fired power plants, gas-fired power plants, right? But also combustion, as I said, several times during this presentation, when we are burning fossil fuels in our vehicles, whether it be passenger vehicles, small trucks, light duty vehicles, and our heavy duty vehicles, whether it be buses and our trucks that we use for more industrial uses. And so you can see the impacts of coal, you can see the impacts of oil, and also the impacts of natural gas. And so, as I've said, previously, there are numerous kind of impacts of fossil fuels on public health. And this again, you bring in climate change to this. So respiratory illnesses, also issues of mental health and poor birth outcomes, environmental impacts as well. So I think for us, when you think about, this presentation and this program you're in, when we talk about climate change and equity, yes, the greenhouse gas emissions are important, but remember the co-pollutants are very important when we think about transportation and burning of fossil fuels, and why we need to use alternative, sources, using renewable energy, why we need to move away from burning fossil fuels, but also there's other negative impacts on human health, mental health impacts, quality of life impacts, and also numerous negative impacts of fossil fuels, particularly in the climate change context, on impacts on the environment. So a 2021 study by Harvard University attributes 8.7 million annual global deaths to fossil fuel production. And of course, we know that air pollution exposure, we're still, in the pandemic, I know we have, I'm not sure which variants this summer. I think it's 2 new variants, but there's an association between air pollution exposure and COVID-19 mortality. In a study by NAACP called Fumes Across the Fence Line, and this is more on the energy combustion side, that 90 million Americans live within 30 miles of at least one refinery, and African Americans live within 3 miles of one refinery or more. African Americans are 75% more likely to live in a fence line community, and more than 1 million African Americans live within a half a mile of existing oil and gas operations. So again, when you think about putting transportation issues in the context of the larger energy infrastructure, right? These communities can be impacted by highways and byways. Simultaneously, they may be hosting other operations that are combusting fossil fuels that can also lead to a degradation of air quality and higher kind of intensity of greenhouse gases in that kind of that air shed, because of the multiple sources of fossil fuels that are being used by multiple facility types, multiple operation types, right? So think about the cumulative impacts of transportation, use of fossil fuels, cumulative impacts of housing, use of fossil fuels, cumulative impacts of industrial uses of fossil fuels concentrated in areas where you have more vulnerable and susceptible populations. So policy recommendations, let's look at the time. Okay, policy recommendations. So I mentioned briefly earlier, Executive Order 14008. I want to say I was telling some of my staff recently. I wrote a blog a few years ago. Is President Biden the first climate justice president? And the center of that blog was really about this Justice 40 framework and Executive Order 14008. So as we move from a dirty energy economy to a clean energy economy, 40% of the benefits, minimum 40% of the benefits of federal investments should go to disadvantaged communities. So that's really relevant to our conversation, because when we talk about transportation, right? Transportation justice, transportation equity, as we move to having a just transition, part of that just transition is making sure these communities have fewer highways. I'm not sure y'all know about this. There's a whole no highway movement in our country and then globally, like moving away from highways and going to car-free zones. Now, that's happening. The car-free zones have happened in certain parts of Europe. Of course, you're probably watching the Olympics as we talk right now, right? And I was in Paris about 2 months ago for environmental justice conference, and there was a lot of traffic, y'all. I was worried. I was there 2 months ago. How are they going to do the Olympics with all the traffic they already had? But they do have some progressive policies about reducing vehicle use, vehicle miles traveled in Paris, that could be a model for some of what we do in the U.S. And also there's other countries in Europe, I believe Sweden, Switzerland, Belgium, that have done some work to have car-free zones in their urban centers. Okay. Now you did see, of course, when you watch the Olympics, you still see vehicles traveling around the Champs-Élysées and Arc de Triomphe, right? But but I think it could be much worse. Maybe they're hiding all the traffic, but they do have some really progressive there, right? But so this framework around Justice 40 is a really important framework to get us to, reducing the impacts of transportation as a major source of greenhouse gas emissions. And so when you think about your work again, and just want to kind of interject some other items that may be food for thought for you. I've done some work with the National Academy of Medicine. They have their grand challenges on climate change, I think in equity and health, something like that. That could be, they're doing a lot of work to try to look at different sectors and how these various sectors contribute to, greenhouse gas, climate change, greenhouse gas emissions in driving climate change. But one of the things we talk about is the role of the healthcare sector in being, an asset, not just reducing your greenhouse gas emissions, but how you can be positive infrastructure to be in the climate justice movement. So that just may be something for the program to think about how you better connect it to the National Academy of Medicine's Climate Communities Network, the National Academy of Medicine's Grand Challenge on Climate Change. Just want to interject that real quick. And so energy policy is health policy. So Howard Frumkin said this, and he's a former dean of multiple institutions, a major figure in public health. And why is this quote important to this conversation? Energy policy is health policy. Transportation policy is health policy. And both transportation and energy policy are health policy, right? So if you think about the social determinants of health, transportation policy is a social determinant of health. Think about how we're going to address climate change and help, really advance our efforts around climate change mitigation, adaptation. We have to get a better control of transportation, making sure there's equity, right, and access to multimodal transportation, bike lanes, I'm not sure how much y'all are into little mopeds, electric mopeds. Okay, cool. But more buses that run on, their electric buses, also school buses, not just commuter buses, right? making sure that we're moving cars. For the more buses you put on the road, the more cars you can move off the road, and the more buses you put on the road that are electrified. Of course, they're not producing combustion byproducts, but it also means there's fewer cars on the road that maybe still burning fossil fuels. Because again, as I said earlier, even with a lot of the work with the Inflation Reduction Act and the rebates and the tax incentives for folks to buy either new hybrid, plug-in hybrid EV, right, or used, that is not accessible to most Americans. And it's definitely not accessible to many Americans who live in public housing or who may live in urban cores where there's transportation deserts. So even when they may have metro systems, right? For those of you from Atlanta, Atlanta's metro system is not equitable, right? Even for those of you who live in DC, there's some neighborhoods or areas that don't have a lot of stops, or they don't stop as frequently. Okay, so we have to decarbonize our transportation systems, and so there's a report, a National Academy of Sciences report on decarbonization, and just wanted to say, this slide talks about Maryland, but that's an important report because it talks about, as a part of our just transition, how do we decarbonize our transportation system? So decarbonization is an equity justice issue. It's an equity issue. It's a justice issue. It's a public health issue. Okay. And so when we think about, transportation systems and reducing the impacts of transportation systems and reducing the impacts of climate change in general, green infrastructure, nature-based solutions are important. So how can we bring more of, that type of ethos and approaches into our communities to bring in more multimodal sort of systems, but also make sure those multimodal systems are framed around nature. So if we do have pollution emissions, that we have vegetation, we have tree canopy that can help with shading and cooling as needed for the buildings, right? But also can help with air pollution mitigation, right? Absorb that CO2 and produce oxygen. We also should prioritize workforce development, right? So making sure that we have, if they're gonna have, workers in this just transition, that as we transition away from, inequitable transportation system, a more equitable transportation system, that a just transportation system, that we have jobs for folks who can actually build those cars. I know there's a lot of automation now that's a limited number of opportunities, right? But on the maintenance side, y'all, that folks who live in these communities are able to do that maintenance work. So I know many of our neighborhoods have a lot of auto body shops where they're doing work on cars that are, gas guzzlers, right? But why not envision those shops being shops that help do work on our EVs, our plug-ins, our hydrogen fuel cell cars, and that those communities are prioritized for that type of infrastructure and opportunities because they're the ones that have been dumped on by these pollution-intensive highways and byways. So as a form of reparations or reparative justice for those communities who've been impacted by the National Highway Defense Act, and we're impacted by urban renewal and by displacement, right? That they are able to benefit. And so that's what we call a distributional justice issue. And that's part of what undergirds, or the ethos of Justice 40, is making sure that those who have been impacted, they get justice and they get more of the positive benefits of the Inflation Reduction Act, of the bipartisan infrastructure law, which would help us, when it comes to climate change, right? So this climate justice and climate equity. Encourage EV uptake. So we do have states that are doing that. So EV uptake, encourage to make sure these communities that we transform these highways from pollution intensive, usage, so that less pollution intensive emissions on the highways to more EVs or other types of vehicles that are not combusting fossil fuels on the road. We also look at the work of EV-NOR. EV-NOR is a group, Dr. Shelley Francis, actually went to grad school with Dr. Shelley Francis. They do a lot of work to look at equity issues when it comes to EVs and also charging stations. So making sure those communities, again, have been dumped on by highways and byways, they've been used as sacrifice zones. And as Dr. Bullitt said, highway robbery and transportation racism, they're making sure that those communities are at the front of the line when it comes to new infrastructures. So make sure those communities are the ones that have access to the microgrids, the smart grids, the EVs, the charging stations. So then they can produce, reduce, you have reduced emissions, greenhouse gases and co-pollutants, but also you're building opportunity, y'all. You're investing. Remember with segregation and redlining, that was disinvestment, divestment. How can we reinvest? So how can we build transportation-oriented development? That's a term in urban planning, TOD, where we focus on, housing, energy-efficient homes, smart buildings, right? For public housing too, okay? Affordable housing, but also accessible transportation that is not pollution intensive, but it also builds opportunity, and we can address some of these gaps, wealth gaps, and also health gaps. So again, there's funding out there that you see coming out of the Department of Transportation. Again, because of the Justice 40, and some of the other federal initiatives, we see dollars coming out of the bipartisan infrastructure law. We see dollars that coming out of the Inflation Reduction Act that kind of coalesce and intersect a lot around this. And DOT has gotten a lot of those dollars to address some of these transportation justice issues that I've outlined. So again, for you in this program, how are you engaging with your county Department of Transportation or your state Department of Transportation? How's your hospital or your hospital system or your medical system? How are they engaging with these agencies, these partners, to say, hey, we want to make sure that our patient population, that they are not being exposed to combustion byproducts, right? That they're not being exposed to greenhouse gas emissions that lead to flooding in their neighborhoods, right? Where they're not being or trapping of heat because there's so many greenhouse gases that have been emitted in the area because of the amount of highways, the amount of cars that are still gas guzzling. So that's part of the framework that you can use to, as a provider, as if you're a physician advocate or physician researcher, right, to really engage with those agencies who have access to the dollars. For example, y'all probably saw the economic pollution prevention grants. Those were announced recently, right? Who has access to those monies? How can your hospital system, medical system, how can you as a provider be a partner, be engaged in implementation of those projects that make sure any projects, particularly transportation related or other, projects that will help, make us, reduce climate impacts, reduce climate hazards, right? Mitigate climate hazards. How can we engage? You also have the money, the Solar for All money, or the Greenhouse Gas Reduction Fund money. So how can you be part of a collaboration, a consortium, right? That's engaged in your area to access those dollars to bring in more climate resilient infrastructure, which will be beneficial to those populations, but particularly if you are providing to patients who may have high risk of asthma, providing to patients who may have a history of infarctions, right? A stroke, or you have a catchment area where your catchment area is a catchment area with a lot of highways and byways. There are dollars available right now that can be accessed, that can be part of the solution. So that's all I have. I'll stop there and thank you.
Thank you so much, Dr. Wilson. That's a fantastic presentation and very valuable information. We're going to open up for some questions. There is one in the chat. Are solar panels being used in these vulnerable urban areas? And who advocates for these communities when state legislators may not be focused on vulnerable urban areas?
Great question. The Solar for All Act, I'm not sure how much money. It's like the EPA has got more money than ever gotten for some of these programs. And also, of course, a lot of this money when it comes to solar is coming through DOE. So two of the all the federal agencies have gotten a lot of money, except for maybe Health and Human Services for some reason. It hasn't got as much money. But I think I think solar is a great opportunity for many communities. And the Solar for All program, I think, is part of the Greenhouse Gas Reduction Fund. It's related to the Greenhouse Gas Reduction Fund. And for example, in the state of Maryland, when it comes to implementation of the Solar for All program, we have green banks. So many of the green banks across the country are doing the implementation. And so in the state of Maryland, it's the MCEC is the green bank who's helping the do Solar for All. And I know MCEC is working with a lot of workforce development groups who are training folks from these communities to be solar installers, solar contractors. Okay.
And the second part is advocacy. Who would advocate for the advocate?
Yeah, with the legislature. So it depends on where you are. I mean, a lot of your, for those of you who may be in, for example, American Public Health Association has chapters, right? They're doing some advocacy work. They're with Moms Clean Air Force. Some of y'all may know about Moms Clean Air Force. That's another group that's doing advocacy work. It depends on where you are. I mean, where I am in the state of Maryland in the Mid-Atlantic, we do a lot of work with frontline fence line grassroots organizations that are advocating. We also work with some of the green groups like Maryland League of Conservation Voters, Maryland LCV, to do some advocacy around this. And so I also, work directly with some of the legislators on bills. And so it depends on where you are. But I think if you think about your professional associations, that's a place to start. Of course, you have Doctors Without Borders. I think they're also doing a lot in this space. I think the LA chapter is doing a lot around climate change and climate advocacy, right? And of course, there are also faith-based groups. I do a lot of work with faith-based groups. The Interfaith Power and Light is one of our partners in the DMV area. So it just depends on where you are, but there are many groups that are advocating on these issues. But I would encourage you to find an environmental justice or climate justice group, because they're going to be ones more than likely working on the ground with folks who have been impacted right now by climate change as we speak.
Thank you. Dr. Keel?
Thank you so much for your presentation. This was sort of so top of mind and top of topic for me. I work in the Bronx at Weiler Hospital, part of the Albert Einstein system. And and I just actually started working here in the beginning of July. And so these are some of the things as a chef fellow that I've begun to think about. I wanted to know, you had mentioned grants to healthcare sector entities about, being more participative and supportive in terms of mitigating the harm that's going on around them. And is there any published work about what has gone on, whether in New York or across the nation?
Yeah, that's a good question. On the grant side, one grant I did not mention that would be a great grant for all of y'all to look up. Let me just say this, y'all. It's the best of times, the worst of times. It's one of the best NOFOs of funding opportunity. It's also one of the worst NOFOs ever seen. It's called an EPA Community Change Grant. So it's $2 billion fund. The proposal due November 21st. They've only given away $325 million because it's like a 90-page NOFO. It's bad, y'all. But it's 1.7 billion left. Okay, so wherever you are, you should be. And one strategy too, in that, and so they have climate action strategies they want you to use and pollution prevention strategies. So climate strategy one is nature-based solutions, which I talked about. Climate action strategy 2 is on mobility, which is the theme of this presentation. So alternative forms of mobility. So you could engage with folks, Department of Protection, New York Department of Protection, DEP in New York, the Health Department in New York. And I know they're working on community change, because I actually just had a call today with one of my I actually have a Climate Justice Fellows program. And one of my Climate Justice Fellows, we're talking about a proposal they're submitting. I forget if they're in Brooklyn, but they were talking about they're working with DEP, New York DEP. And then also you could work with there are some, I think there's a Climate Justice Alliance, I believe, in New York City that may be a partner to work with.
Okay.
Then what's Rhea's name? Rhea Salter. Rhea Salter is another person who does climate justice work, who I'm not sure she's doing well, but she was a good person to talk to as well in the city. And then, I would be remiss if I say this. So we have something called the Thriving Communities Technical Assistance Center, TICTAC. The TICTACs are supposed to give technical assistance, capacity building support for organizations to apply for federal grants, one of the main themes. And so your TICTAC, because you're in Region 2, because you're in New York, is We Act for Environmental Justice.
Okay.
So those would be people to start with, groups to start with.
Thank you.
You're very welcome.
Dr. Glover.
Tremendous talk. I wanted to let you know that we try, and we're in the process of still trying to do a microgrid for West Angeles Church of God in Christ here in Los Angeles. We met with Governor Newsom and some of his people, but they're pushing, EV and all that. But we wanted to set up, the solar system to do a microgrid. We met with some of the power companies, and we were directed to do that EPA grant. And like you said, that's a monster, man.
Dude, it's a beast. I've done hundreds of proposals in my career. That's the worst proposal. It's the worst experience I've ever had.
So basically having the skill set to navigate that is really become pragmatic for us.
Dr. Glover, I'm smiling, not because what you said is wrong. I was just on the call yesterday with a group. So Greater Church, so you mentioned church, Greater Church, Reverend Dr. Ambrose Carroll. He's based in California.
Okay.
He would be the person to talk to. He actually has a partner, Dr. Kinslow II, Kinslow. I think he's at UCLA or USC. And Dr. Kinslow, he has a company called Gemini Solutions. And guess what he does, Dr. Glover? Microgrids.
Okay. But
So, Kinslow, shoot me an email. I'll connect you to I got excited. You're right in their backyard.
Okay.
So
I'll send you the proposal that we did to the PowerPoint so you can see it.
Yeah, let me put my email in the chat for you, so you can shoot me an email. I can connect you right after we get off this call.
Cool. Thank you. Appreciate you.
You're welcome. Here it comes.
Our last question is Dr. Curley.
There you go. It's in the chat. Yes, Dr. Curley, go ahead.
Can you hear me now?
Yes. Go ahead. You're good.
Okay. Thank you so much. I am always that, when we do work in Africa and we have all these mammography machines that have been used and discarded on the road, they're still on the road. So what happens, and is there any money, or is anyone thinking, doing some forward thinking, like when the solar panels are no longer usable, when our EVs are no longer usable, how do we go about recycling them? It's great that we're moving forward with this, but everything has a shelf life. Yeah. So are we talking about the shelf life at all?
Yeah, no. So life cycle assessment is a very important part of this discussion with all these federal dollars. So EPA, so we call it a circular economy, right? Because as you know, I have a colleague who did a book called I'm forgetting the book. He did a book, Garbage Wars, which talks about how a lot of our e-waste gets shipped to other parts of the world, and how those groups are being impacted. So there's been a lot of discussion, even Dr. Curley, on the front end with the EVs, the lithium mining. That lithium mining is impacting indigenous populations in our country, right? There's also cobalt mining. Cobalt mining is impacting folks in Africa. So we're trying to have this transition, right? But there's still some collateral damage that's happening. So how do we reduce that collateral damage on the front end? And as these products come to the end of their life cycle, we got to have policy pieces in place using a circular economy framework, so we can reuse those minerals, and so that's the EPA does have some investments in that. But to your point, and it's going back to the comment, is it Dr. Clell? How you pronounce your last name? Donna, how you pronounce it?
Keel.
Sorry, Keel. Dr. Keel's point, in that climate, and also this point with Dr. Glover, in that community change grant I just mentioned, there is a climate action strategy on waste. So in the community change grant, they are talking about waste management, reducing waste streams, recycling, life cycle assessment, circular economy. Okay.
Thank you so much, Dr. Wilson.
Yeah, thank you. And great question, Dr. Curley.
So this has been a fantastic webinar. We appreciate your expertise and time. And in the chat, we have placed a link to complete a survey. We ask that you complete that before you leave, if you could take a moment to do that. And as we announced at the start of the webinar, we are pleased to offer continuing education credit for our webinars this year. To claim that credit, please follow the link in the chat or scan the QR code on the screen and follow the directions on the website. Today's activity code to claim the CME credit is 13264. Thank you so much for joining us. Have a wonderful weekend.